My name is Tiana Hill. I'm one of the behavioral health professionals at C2P. Here answering questions, any questions you all have about how to cope with anxiety, isolation, how to get connected and stay connected with family and friends during a moment of like the quarantine and the stay-at-home order. So I look forward to our discussion.
Hi, my name is Julia Rosebush. I'm the medical director of Care to Prevent, and I'm here to answer all of your burning questions about COVID-19, ranging anything from symptoms to masks and gloves, anything that's on your mind. So please submit your questions, and I hope to have a really riveting discussion today.
Yes, yes. So one question, Dr. Rosebush, was, should I wear a mask?
That question came up. All right, well, this is a good one because everybody has been asking this question. And the long and short of it is that, yes, if you have access to a mask, it is preferable to wear one. This does not mean that you can ignore the social distancing rules in order for us to significantly decrease transmission of the coronavirus from person to person. We encourage people to not only wear masks, but also to maintain distance of 6 feet or more when with other individuals that are not in your immediate living situation. We obviously, for people who are riding public transportation, who are going out to the grocery stores, who may be driving Ubers, who may be in more of the service sector of society, it's really important. And I think it's a good reminder as well that wearing a mask doesn't necessarily protect you from others. It helps to protect others from you. So if you need access to a mask, please inquire with one of our team members, and we can certainly figure out how to get one to you in a safe and effective way.
Yeah, yeah. I know it's a lot of people having anxiety around like wearing a mask. What should I do if I don't have a mask? Like, what can I use? And like, given the whole COVID-19, it provokes a lot of fear and anxiety surrounding health and like how do I keep myself safe? How do I keep myself from contracting the coronavirus? And I know that causes a lot of people to go into a state of panic and fear, like related to the fear of getting sick. And with that, just remaining calm and not putting yourself in like more anxiety provoking fear versus like, okay, healthy anxiety. Like, okay, yes, let me put on the mask so I can prevent myself or have a less amount of risk of contracting or having someone get like catch it from anything that I have. So yeah. So remaining calm and know like it's other things you can do for preventative measures. Do you have any suggestions on what people can do if they don't have a mask?
Yeah, so absolutely. So I think, first of all, definitely feel free to reach out to us to obtain a mask if you are interested in getting one. There are also a lot of initiatives, particularly in South Chicago, that are dispensing and offering free personal protective equipment to include gloves and masks as well. So there's opportunities to get those. However, if those opportunities don't present themselves or you're uncertain of how to do either of those, you can utilize bandanas, you can use a scarf, you can use other materials that are cloth in nature. I think one of the biggest things that even with a cloth mask or any type of mask is one needs to cover fully their nose and their chin. You obviously want to make sure that you can breathe okay, but you definitely want to make sure that for it to be effective, that you are covering with cloth in whatever way, shape, or form you're utilizing it, over the mouth and underneath the chin, and that you are holding back from adjusting, scratching, rubbing, because again, though we encourage you to practice good hand hygiene and do a lot of hand washing, we do know that you can transmit virus from tabletops and other surfaces onto your mask, and then it sort of defeats the purpose, or so to speak, of you then not being a risk to others. You are then a risk to others. So there are definitely some good rules and regulations around mask wearing. We'd also suggest that after a day of wearing your mask, that you wash it in warm soapy water and hang it out to dry, and then it can be reused. The surgical or procedural masks that a lot of people are wearing are really only intended for single use at this time. So while people may be extending the use or wear of that personal protective equipment, those particular masks are really only intended to be for a one-time use. So hopefully that answers.
What about wearing gloves? Should I wear gloves? And what is the proper way to wear gloves?
So gloves sometimes are a little harder to come by, especially the disposable type. But again, there may be organizations that are offering these. And the place that I would probably recommend these would be if you are going on public transportation, or maybe into a grocery store or somewhere where you may come into contact with a lot of surfaces, touching doorknobs, touching door handles, opening bus door, things like that. Or essentially putting your hands on a shopping cart or something like that. And again, gloves that are disposable are really for single use. They shouldn't be, worn multiple times because they lose their effectiveness after a period of time. But certainly I think if one is out and about in the community and is coming into contact with a lot of potential exposures, I think wearing gloves does make sense in that regard. But just around the house, kind of in your daily interactions, you shouldn't need to do that.
Cool, cool. Thank you. Thank you.
Hannah, I have a question for you, if you don't mind.
Yes, yes.
One of the things that people have brought up is concern about feeling afraid to go out to the store, or afraid to leave their house. And then, as you mentioned earlier on, that kind of helps you to run the risk of being isolated and sort of losing that human connection. What are some good ways that you've encouraged people to work through those isolative feelings during this time?
Yes, yes. Of course, it's a lot of fear of going outside. I like me and Dr. Rosebush want to remind you it's okay to go outside for the necessities. Like if you need to go to the grocery store, it's okay. Like wear the mask, the proper equipment. It's okay to go sit on the porch, get some fresh air, because sometimes we need, fresh air. Um, but one thing is going into isolation, like staying connected, whether that's via phone call, via Zoom. They have like party app, like the house party app where you can go and chat live with some friends. You can play games on the app. They also have like FaceTime if you have like iPhones. They have Duo, I think it's Duo. That's how you spell it. Where is it like another like FaceTime like app? So it's different apps that you can find where you can go live and look at people. I really, really strongly encourage that and encourage this, because when you're sitting in isolation, especially in a time like this where so much fear evoke like is going around, it causes you to have a lot of stress, a lot of anxiety. Your mind just start rumbling and rumbling and rumbling. And it's important to always be surrounded by community. Like in order for us to heal, in order for us to grow and get through this, we have to be connected to community. And as friends, families, like some people that you just check in on, like it could be a brief check-in, not draining long conversations, but like check in, whatever fits best for you. Also coloring books, they have like the adult coloring books, drawing, writing, like doing different activities that you can do in the house to relax your mind, relax your body, like so practicing mindfulness through listening to music, through I like the 5 4 3 2 1. So when you're feeling like that panic coming, like a panic attack or an anxiety attack, is one like doing some deep breathing. So like breathing into, like getting centered where you're at, breathing into your nose, out through your mouth. So like regulating your breathing, feeling that, but remembering like the 5 4 3 2 model. So as you feel in that anxiety, look around the room and five things you see in the room. Like you still breathing in and out, but five things you see in the room. You can say them out loud. You can say it in your head. You can listen to four things that you hear around you. So not focusing on the exact four things, but like, do you hear the car? Do you hear like wind blowing? Like four things around you. Three things that you can smell. So like, do you smell perfume, the body wash? Like three things you can smell. Um, two things that you can um take, like feel, two things you can feel around the room. Like, do you feel like the the seat that you sitting in, the pillows, your clothes, your jeans, or one thing you can taste? And it don't have to be in this order, but it's like essentially the five senses. So like see, taste, touch, feel, and smell, so like doing that as a way to get grounded, like for an activity. So when you're like hyper vigilating or getting anxiety, like getting back centered into the body, that is a way and a tool you can get back centered into the body and reminding yourself that you are okay. Like you're going to make it through this. This is just a moment in time. Like we're going to make it through, and we're okay. Like we're okay.
I really like that. I think it's something that you can do kind of anywhere that you are, right?
Mm-hmm.
And like you said, it doesn't really require a verbal component. So if you're, on a bus or you're, somewhere where maybe you don't want to be known that it is that you're doing what you're doing,
Right.
it's pretty discreet too, and just easy to remember. So I really like that. Thanks for sharing.
Yeah, no problem, no problem. That's like one of the activities to do because I know it's like a lot of
Mhm.
anxiety around that. With isolation, is it okay to visit family? Can we go visit family?
Yeah. So I think that that's a great question. And obviously, as you said, Tiana, it's extremely important that we maintain our communication with people, especially the people who we love and the people that are close to us. I think that there are definitely some discussions that families need to have with one another wherein visiting is concerned. Um, I don't think it's wrong to visit family, but I do think that one needs to think about who the family is that they are visiting. Certainly, we know that COVID disproportionately affects and is more severe in older individuals. And so, people that are elderly or over the age of, I would say, probably 55 or 60 would be at much higher risk of a fatal event, or just a really severe course if they were to contract illness. And so I would also say that that would extend to people whose immune systems are not functioning properly, right? So people that are receiving immune suppressants or who don't have robust immune function, they could also have a severe course. So I think it's very important for people to understand sort of what the risks might look like. And again, if it does involve, I need to go over and see this family member, then it may be wearing gloves, it may be wearing a mask, it may be avoiding public transportation. And if you can access a bike or some other way to get there, that wouldn't require you to be exposed to a bunch of people en route to family. I think that those would be feasible options as well. So, we definitely don't want people to feel disconnected or cut off from family, but I do think it really warrants an exploration. Um, you know, um, I think it does warrant sort of yeah, that's what I think. Sorry, I got sidetracked because I saw
No,
that just came up in the chat and I wasn't expecting that.
no,
So
it's okay. I was going to actually read that question off.
go for
It's
it.
saying like, what should I do if I've been in contact with someone who has been tested and is positive for the coronavirus.
Yeah. So if that in fact is the case, we do know that people who are asymptomatic or people that don't have any symptoms of coronavirus infection could still potentially be infected. And a lot of this has to do with, how frequently you were in contact with the positive person, what kind of contact that was. But what we would recommend at this point is that if you have been in close contact with somebody who is positive, right now we don't have testing in place for persons who are not symptomatic or not with symptoms. So we would recommend self-isolating for 14 days in order to ensure that you are not unknowingly transmitting the virus out and about in the community. And I know that self-isolation is not possible for everyone depending on their living situation. So we just ask people to do the best they can during this time. But we realize that self-isolation is not feasible for everyone. So keeping that in mind.
Yeah. The other question is having HIV or another STD considered a high risk for the coronavirus?
I'm really glad that this question came up because I was hoping to discuss this anyway. So right now, based on the data that we have, we don't believe persons who are living with HIV are any more likely to have a severe course of coronavirus compared with non-infected persons. I think that we have a lot of data, we have a lot of numbers that we need to look at, particularly in other countries who are also affected by this pandemic, to really get a great or a better, I should say, understanding of what that risk really looks like. I think that there are a couple of things. I think for people who have robust CD4 counts, who are taking medications daily, and who have good control of their virus, they absolutely should not expect to have anything unusual that a person who is not HIV infected would have. The thing that makes HIV a little bit more complicated is that oftentimes, and especially with aging, people are more at risk to develop high blood pressure, diabetes, perhaps, problems with sugar control. So diabetes, like I said, is another one. Also, some kidney and heart dysfunction. And this is just because of the inflammation that the virus produces. And so if people who are living with HIV have other diagnoses, or as we call them in medicine, comorbidities or comorbid conditions, then they very well may be more likely to have an adverse event or have a rockier course, or so to speak, because of those underlying conditions. We know that people who have these baseline medical conditions, even if they are not HIV infected, tend to have more severe courses and tend to be sicker. So I think that that's just one thing to kind of keep in mind, that a lot of it has to do with whether or not you have any sort of underlying health conditions in addition to HIV. STI, sexually transmitted infection and diseases, do not have any sort of, they do not, to our knowledge, have any sort of impact or effect on how susceptible you are or what kind of a course you might have if you do become infected.
Sorry, I put my phone
Oh,
on.
that's okay. Tiana, I did want to ask you, what kinds of resources, I know you talked a little bit in the last question kind of about what you've been recommending for clients in terms of engagement with community. Are there any sort of resources that you can recommend to people if they feel that they're in a crisis type situation, or sort of what advice would you have if the things that you've instructed them to do are not working, but they want to do, or they want to do more?
Yeah, definitely. So we actually have a list of resources on our Facebook page as well, that you can like contact. It's a list on that, as well as on actually on our web page. You can go to our web page and they can give you a list of like links to specifically go to. Of course, if you having a crisis like where you're feeling suicidal and can't get in contact with your mental health professional, if you have one or not. You can always call the suicide hotline prevention hotline, and that number is 1-800-273-8255. And I'll say it again, 1-800-273-8255. You can also go on our page, like if you need a check-in, like you want to talk to someone, talk out some thoughts. You can go to our page. We have Ask a Friend, where it's a therapist is there, and you can contact them. Like they'll back in contact with you. Also, it's certain community organizations. I'm gonna put on a Facebook under here, I'm gonna put it on there, like the actual links to certain community organizations that you can go to try to get enrolled into therapy, because it's a lot that's going on now, and like our thoughts get to us while we're in isolation. um Journaling is something that you can do and write out. Participating in art therapy at home, whether that's drawing, whether that's like using painting, you can just take a pen and like write out something that you can do right now in that moment. Also, if you are in a middle of, let me pull up the exact number. I'm giving out all these numbers. I'm sorry. I'm like, I hope people have pens and paper, like listening to us. If not, like we're gonna provide the information on like the Facebook page, or it's also giving um like on our website, on the C2P actual website, you can find some of this information. But another um place you can contact, I want to give the exact number. So I'm sorry. Because I want to give you the exact number. Okay. So it's if you are experiencing domestic violence and you need to find a hotline number, their hotline number is 1-877-863-6338. Once again, that number is 1-877 863-6338. And I know in the middle of a crisis, like it's sometimes scary and provoking, but I recommend having these numbers saved in your phone so you can like contact, and you can put it under like different if you're scared that somebody might see it, you can put it under like different names, but have these numbers stored so that's something accessible to you that you can, like in the middle of that crisis, you can call, like automatically go to, and don't have to try to research the numbers of have the numbers on hand.
Thanks, Tiana. When you were talking, something else kind of popped into my head, and I think that this spans sort of both of our areas of interest and expertise, but that's the question of substance use. And I think one of the things that, was reported out now maybe a few weeks ago was that certainly smoking marijuana and tobacco in general just increases risk for a more severe course of coronavirus. And that would obviously be related to the fact that the coronavirus tends to attack the pulmonary system, the lungs. You're inhaling smoke, you're inhaling, marijuana smoke. Certainly, that could predispose one to having a more severe course of coronavirus infection if they were to become infected. So I think it's a really good practice to just sort of keep that in mind. Again, I think there is a lot for us to learn yet about why exactly that happens, what is the impact or effect of other drugs on coronavirus risk and course. But one should just generally assume that, depending on what kind of drug you're utilizing and how you're taking that drug, that it certainly could impact your course if you were to become infected with COVID. So I just wanted to share that tidbit. On a related note, I also ask that people heed the warnings from all of the manufacturers of disinfectants and cleaning agents, that these are by no means, by no way able to be ingested or should be ingested. They should not be injected. These are to utilize for cleaning purposes and cleaning purposes only. So I know that there has been a lot of misinformation in the media, in the news, about the potential that these agents have to attack or clear the virus. And I have to say that I read an article that shortly after this information became available, the calls to the Illinois Poison Control Hotline doubled in just a couple of days. And so know that there can be fatal consequences, and we really want to try to avoid this at all costs.
Yeah. I think that's one thing that's really important to know, because on Facebook, Instagram, all these different social media platforms, they have information on what you can do to like prevent yourself, or like these remedy, like home remedy tools, and it's like very questionable. So just be aware that some of the information that's out there is false and can get you sick. Like check in with a medical provider before you decide to like switch up some type of routine, take a pill, or like make some type of concoction that people say supposed to cure you or prevent you, because some of this is like false information. So being aware of that. Mm-hmm.
I think that you bring up a really good point, Tiana, because knowing where to go to get reliable advice is really important, especially because there's so much out there that is inaccurate and that doesn't really portray the truth. So, we as Care to Prevent staff members are here to serve as a resource. No question is a stupid or a dumb question. There are a lot more questions than there are answers right now. But, we are up to date as best we can be with all of the data that's coming forth about this from reliable sources. The Centers for Disease Control and Prevention, the University of Chicago's website. Those are a few places that people can access to get routine, sort of up-to-date information about coronavirus. And, the other thing that I want to say about, misinformation is to, again, just don't be afraid to ask the questions. Don't be afraid to go to the sources, and always ask if something doesn't seem right to you. I think it's best to trust your instincts in this situation. So certainly if anything seems unreliable or a little bit strange to you, chances are that's a good instinct, and that's definitely something that you should inquire about before you decide to engage.
Yeah. So no drinking bleach, no using any type of cleaning supply. And the whole if I can hold my breath for 10 seconds, does that mean that I don't have the coronavirus? That's something that I've been seeing going around over and over again, where people are holding their breath for 10 seconds to prove to themselves that they don't have the coronavirus. Is this a myth, or is this some type of truth because of like the
Yeah.
breathing?
Oh, you're asking me?
Yeah.
Okay, yeah, no, this is a definite myth. And there are a lot of these types of myths out there. The only way that we can really prove whether or not someone has coronavirus is to test them for it. And, as of right now, we are only testing people who have symptoms, though, people who might come into the hospital for to deliver a baby or to get a routine surgery or something like that, they may be screened even if they don't have symptoms. But that's more for what we call surveillance purposes or monitoring purposes, just to get an idea of how widespread the infection is within our community. It's not to diagnose, to diagnose people. Yes, of course, you'll find out if somebody has it that way, but we're not routinely screening people unless they have symptoms like cough, sore throat, diarrhea, runny nose, body aches and pains, headaches, those types of symptoms, and fever as well. I think it's also one more thing that I want to just bring up is that though we're getting new data on this every day, there currently are no approved treatments for coronavirus 19, COVID-19 infection. There are a lot of trials that are ongoing, some that are ongoing here at the University of Chicago in our adult populations. But right now, we don't have any kind of specific data to say that one drug or one therapy is better than another. In fact, a lot of the success that we have seen in patients recovering have been due to more supportive measures or things that we have done just as an adjunct to treatment, not necessarily a drug. There's some really promising drug data that's on its way. It sounds like it's going to be reported on here in the next few days or so, which is really exciting. But right now, the guidelines don't prefer any one particular treatment over another for the virus.
I know something that just been coming up is like, what do I do in the boredom? Like, I'm tired of being in the house, especially if I'm by myself, or me and my family done played charades like 1,500 times. Like, I'm tired of this. What do I do? I don't watch the whole Netflix series. Like everybody, like, what do I do? Like, it's another month. And I think another thing you can do in the boredom is practicing different, like, be creative with your self-care practices. This is going to be another question after this, but I know a lot of people use getting their nails done, getting their hair done, going to get a fresh haircut as a way of practicing self-care and self-love. So like, what do I do when I'm not able to go outside and do that? One is trying them at home. Like, you can suggest YouTube videos to cut your hair, but be very, very, very safe and very, very, like, I do not recommend using scissors, dyeing hair, like none of that if you don't know how to do it. But one is like soaking your feet in a bucket of water, giving yourself like a pedicure, a manicure, combing your hair, like brushing it back, just combing it out, using some oil, like just doing different things on your own to make yourself feel good. Like, that is another self-care tool you can do to build up like your confidence, and like sit and be like, I am beautiful, I am good the way I am. That's healing within itself, like looking at yourself in this moment and just having satisfaction of who you are in this present day. Whether you have a bathtub, like, you can take a nice relaxing bath, or you can take you a nice relaxing shower, give yourself a facial, like doing different things like that while you're in the like boredom, giving your like sitting and doing like at home workout videos or practicing a workout routine yourself. Do not lift heavy thin objects and materials, because I done seen people like trying to do like use the couches like bench press. Do not do that. Do not hurt yourself trying to work out at home. Like, so don't do these type of things, but like do stuff that you can do at home to get your body active, to get like the adrenaline pumping, taking care of yourself. Just because you have to stay at home does not mean you can't take care of yourself. So still getting that motivation to get up and get dressed, get up and get in the shower, get up and brush your teeth. These are things that help you feel good in the middle of this moment too. Doing scrapbooking with the time, reading a book, like learning a new language. We have like different things on our phone, or different books that you can do to learn a new language during the boredom, as well as doing a collage or getting a piece of paper to like write things out. Like, what do I want to do after this quarantine? Like, where do I want to travel if I can? Like, do I want to start a business? Like, what would my business look like? So these are things you can start focusing on. Because I know before the coronavirus, there was a lot of talk like, I don't have the time to focus on myself. So here's time to like focus on yourself, focus on dreams and visions you have for yourself. So utilize this time to really get in tune with yourself and think of it as a positive way of accomplishing some of those goals. So, yeah.
I like that forward thinking.
Mm-hmm.
That's really fantastic. You know, don't think necessarily about the current moment, but think about what you're going to do after.
Yeah.
Yeah. So awesome. I think that there was another question that was posed. If young people don't die from coronavirus and have more minor symptoms, should they still be concerned about getting it? Yeah, so I think that that's a fantastic question because a lot of focus has been put onto the fact that young people don't necessarily have as severe of a course as many of the older adults do. But I do think that there are many cases, both in the pediatric and young adult populations, where that doesn't really hold up. Certainly, persons who are immune compromised or who have underlying conditions, as I had said previously, are certainly at more risk. But I think that we all need to be concerned about this virus because this virus is not acting like other viruses that we know and are familiar with. This virus has a lot of very unusual properties. I think one of the biggest that I have been reading about has been its ability to clot or coagulate blood. And there have been some young people, as young as 30 or 40, and yes, that's young, year old people who, have had deaths or fatal strokes as a result of very mild or even asymptomatic COVID-19 infection. So the inflammation that this virus produces, the virulence that this pathogen actually harbors is very unusual. And I think we absolutely all need to be concerned about it, regardless or irrespective of our age, because even young people are now known to become infected and can have severe courses. So that's how I would address that. Oh. I think, Tiana, what other topics should we?
I think one came about like, how do I keep myself safe when I do ride, if I have to ride public transportation?
Yeah, so I think that that's a good question. So obviously, people need to utilize public transportation. And if you have a job that's dependent on you arriving there safely, we're not going to say to you, do not use public transportation. That's just not going to be a feasible option for a lot of people. And we really recognize that. So the best thing that you can do is be very safe, meaning when you get onto the bus or get onto the L, onto the train, make sure that you are trying to social distance as much as possible. Wear gloves, wear a mask, try not to touch a lot of things with your hands because again, there's always that risk. And we do this without even realizing it of, touching things and then putting our hands to our mouths or to our faces and then maybe contaminating the mask, etc. So I would say that, don't avoid it because you probably need to utilize it, but take the steps to ensure safety for yourself and for those around you. And if everybody tries to do this, it'll be made much easier.
Yeah, I know around this time it's a lot of things that is happening that's out of our control, and like we feeling like a loss of that control, like whether that's losing our jobs, certain things with housing. This is something that's really coming about. This is something that's very concerning and really hard to deal with. So yes, addressing that, with the loss of a job is resources out there like where like they have unemployment that you can apply to, and I know it's difficult and challenging to still apply for unemployment sometimes, or the waiting period. One, I'm not going to say just act like it's everything is okay, because we do have to acknowledge the fact that we did lose a job, like, and it's okay to sit in the different emotions that you have. Like, it's okay to acknowledge the fear, it's okay to acknowledge the anxiety, it's okay to say I'm sad, I'm angry, I'm mad. Like, during this time, it's okay to feel those emotions and have those emotions. Is how you deal with it. One is talking to family and friends about it, giving yourself time to grieve, whether you want to cry it out, scream it out, write it out. Don't get physical with anybody, like in fight anybody. But it's okay to do what you need to do in that moment to feel those emotions and relieve those emotions. One, knowing that it is a way to kind of get control back. And that goes back to the resources that I mentioned. It's other resources like food pantries and food banks that we also have links to on our website, on the C2P website, that you can find, where you can go get different food for today and have access to that. Um, as well as different soup kitchens, like that's open up in the time that they have available to have access to that. Um, so yeah, I do acknowledge that it's a lot of things that's happening that's outside of our control. With that, still like remaining calm within ourselves and still being like, I'm going to make it through. Like, we're going to make it through this. Practicing things that can help you, like, calm yourself down, getting out those emotions, acknowledging those emotions, but not letting, like, sitting in it and going into a downward spiral. Yeah.
I think that that's helpful advice for everyone, Tiana. So thanks for sharing these really good ideas that are really, I think, easy in a lot of ways to implement. You don't need to have anything in particular to be able to do them. So that's really useful at this time. I know that there are a couple of other questions that came up, like, can I pet my neighbor's dog? Absolutely. Just wash your hands. But I would say to do that if we weren't in the middle of a pandemic, just because it's a dog and you should just wash your hands after petting a dog. And then a couple of other questions about, like, should I take my shoes or my coat off? Some people are doing this. I am not doing it, to be quite frank. I don't think that there's any data. I'd have to look to see if there's actual data to suggest that this is effective. I think it all has to do with where you've been, if you've been in a hospital and you've been potentially exposed to COVID-19, then yes, I think it makes sense. Like, wear shoe covers maybe, or something like that, if you're in an environment that would require you to wear them. But otherwise, I think just laundering your clothes and your coat and your clothes kind of as frequently as you can, but not daily or anything that frequent, makes the most sense. But I don't know that there's any kind of data on, like, the necessity of sort of leaving your coat outside or showering immediately or any of those types of things. But a lot of people are doing them just because it brings them the feeling of control. If we're going to talk about a loss of control, I think this gives people a lot more agency over the situation. And so, isn't harmful. So if it's not harmful, feel free to do it. But I don't know that it's been scientifically proven to be an effective way of, controlling transmission.
Yeah. What about disinfecting, like, my groceries?
Yeah, so no real need to have to disinfect groceries. Certainly anything like produce or fruit, those types of things, certainly should always be washed before you eat them, just in general. I know a lot of people are going to lengths to sanitize and clean the outsides of boxes and things of that nature. But again, it's not harmful to do it, but not necessary either. So, well, I think we're probably at the end of our time. And if there aren't any more questions coming in from the thread, Tiana, maybe we can get back together and do this again. It was fun.
Yeah, yeah, for sure, for sure. And providing the links to those resources, like different mental health resources you can access, will be provided after this live.
And caretoprevent.com. That's where you can go get all
Yeah,
the information and let us know what your questions are. It's been a
yeah.
pleasure.
Yes, it have. It has.
All right. See you all later.
See you.
Bye.